we're ready to get started. This is Dr. Fregger. He is an optometrist. So I will let you talk about all about him.
Hi, everybody. This guy, look at him. One guy and all his girls. This guy's got it made. He's figured it out here. Just first of all, I got an issue here. Florida State's perfect up top of the center. The gators need to come down a little bit, and you got two gators up there. One here, one on the side. So what's the deal there? Come on now. Thank you all for inviting me. I'm an optometrist. I'm not an MD, I'm an OD. I went to optometry school. What I did first, to go to optometry school or medical school, you got to go to undergraduate school, which means 4 years at a university. I spent 4 years at Florida State, of course, the University of Florida, Florida State University. And then applied to and got accepted to go to optometry school. The difference between an optometrist and an MD is I studied 4 years of eyes and eyes only in optometry school. Whereas an MD will first go to medical school and they study the whole body top to bottom. After medical school, then they'll go to a residency program, they'll do an internship, and most likely a fellowship, spending anywhere from about 10 to 12 years of education. That was a couple of years too short for me. I wanted to do about 8 years of education. That was enough for me, so that's what I did. 4 years undergraduate, got my undergraduate degree, my bachelor's degree, then went on to Florida to do optometry school. And it was 4 years there. I got a 4-year degree in optometry, becoming a doctor of optometry, or ODs after my name. If you have questions, please pop the hands up at any time. I've got no talk here, I'm just kind of rambling. Go ahead.
Is an ophthalmologist an MD?
An ophthalmologist is an MD, correct. The difference between an optometrist and an ophthalmologist in this state, I don't pick up a scalpel, so I don't do any surgery, and I'm restricted on what kind of pills I can prescribe. I can prescribe any eye drops I need to prescribe, but there are certain pills that I cannot prescribe. Whereas an ophthalmologist is an MD, and in the state of Florida, once you get your MD, then you have the whole unrestricted practice of medicine. What that means is your ophthalmologist can deliver your babies, okay? Your orthopedic can do your eye surgery, okay? Your OBGYN can take care of your feet. Unrestricted practice of medicine in the state of Florida. That's what an MD has. As an OD, I'm limited to the eyes and eyes only. Yeah, so I spent 4 years, mainly what I do is prescribe glasses, treat eye infections, prescribe contact lenses. If eye exercises are necessary, optometrists can prescribe eye exercises to strengthen the eye muscles. But we stop at surgery, as far as picking up a scalpel, cutting on the eye. So I don't do cataract surgery, I don't do retina surgery. I don't want to. I don't give injections into the eye where an ophthalmologist can. And I'm limited to what kind of pills I can prescribe just for the eye only. That's the major difference between an optometrist and an ophthalmologist. You can ask more questions, come on. Why optometry? I was asked why. Well, I had my first eye exam back in 8th grade, and I loved the way the doctor was, the mannerisms, what he did for me. And I could see afterwards, and I got a pair of stylus glasses. That was pretty cool. So I set my sights in 8th grade. I said, that's what I really want to do. My parents were very supportive, very appreciative of that. And from 8th grade on, that's what I wanted to do, and set my coursework at high school and college for optometry. My degree at Florida State, people ask, is in psychology, physiological psychology. What I did first, I studied biology for a couple of years, but there was no biology advisor who wanted to be the pre-optometry advisor. So a psychologist in the part of psychology who was looking at eyes, the psychology of vision, said he would be interested. So I took him on, he took me on, and I studied under him and became a good friend of his. And so I switched my major to psychology, more physiological, the cross, the bridge between biology and psychology. Since I already had all of the courses in the biology department, I switched to psychology. It was almost the same courses. I set the curve, it was great. So I had a good time. Then on to Memphis, Tennessee for 4 years in optometry school. My parents didn't have that much money. My dad worked in the state of Florida, so to help get myself to optometry school, I took an Army scholarship. I am not a military person at all, but for anybody looking for a scholarship, let me talk to you about the military. What a phenomenal, phenomenal scholarship it was for me. They paid everything my last 3 years of optometry school. And by everything I do mean everything. If I need a book, they bought it. If I need a pen, they bought it. If I need a paper, they bought it. Anything I could show that was related to school at all, they bought it for me. You're right. In addition, I got a check every month to live on. I was married, I still am, and we were living pretty good. So I had money coming in from the military to live on while going to school, tax-free. My wife was working, so we had double income going to school, and that was pretty good. When I got out of school, I owed the Army year for year. That was my plan. So 3 years I paid it back as an optometrist. I was stationed at Fort Knox, Kentucky, and spent 3 years there. That's why I tell people that's where I learned optometry. School gave me the tools, which school does, but it's the real world where you really learn it. And at Fort Knox, Kentucky, it was an entrance station for the Army. So trainees got there. We saw trainees day one before haircuts. They got off the bus at 2, 3, 4 o'clock in the morning. They got a hot meal. We would start seeing them anywhere between 4:30 and 5 o'clock in the morning. We would see anywhere between 200 to 400 trainees every morning, then go to the hospital and do sick calls, and then see retirees and dependents in the afternoon. That's where I learned optometry. I'm very grateful for the Army. I didn't see a career there for myself, so I got out, came back here. Grew up in Tallahassee, honeymooned here in Fort Walton. This was the best place to come, so we're here. So I started here in Fort Walton, first on Egmont Parkway in an optical shop. When iMasters in the mall opened up, I moved to iMaster. I spent about 9 years there. And for the past 18 years, I've been with my own practice on Racetrack Road Family Eye Care. That's basically me in a nutshell. What do you want to hear? Go for it.
How did you start your own practice?
How did by the seat of my pants. Honestly, I was butting heads with iMasters. And they didn't like it. I was doing better business than they were. They had, at the time, when I first started with iMaster, they were promoting health, they were promoting getting it done right, and they changed their practice philosophy and wanted to go cheap and low end. And so everything that I had built up as far as a nice practice, they were cheapening out and making it just not conducive to my patients. So I was losing patients. So we were butting heads. My contract was coming up with them, and they said about 6 weeks before the contract expired, get out. So I had 6 weeks to open up a practice. So that's how I started the practice, honestly. They gave me 6.5 weeks to, so if you come by my office on Racetrack Road, everything in that building was done in 6.5 weeks. It was shelled out, and luckily my landlord was getting ready to put blimpies in there, and so he had an architect on premises, and he had a construction crew on premises getting ready to put blimpies there. I said, no, I want this whole building, let's finish it up and do it in 6 weeks. He looked at me and said, we can do it. So everything that you can think of for starting a practice, from designing the logo to the name, to buying the equipment, to the furniture, to the whatever you can think of, I did in 6.5 weeks. I didn't look back. Haven't looked back in 18 years. Best thing I ever did. Yes? How what? Why did I have one?
Your job.
My job? Well, I graduated optometry school in 1982. She speaks too loud. I graduated in 1982. I spent 3 years in the Army, so I moved back here in 1985. Honeymooned here in 79. Yes?
Before you transferred that, how did you have to do an internship? I mean, it just happened.
At that time, back in the 80s, internships and residency in optometry were in their infancy. And in my class, there might have been 3 or 4 of the class of 150 that did that. Now they're more pushing the residency program than 1 year residency. Is it necessary in optometry? No. But if you think you might want a subspecialty in something such like low vision or maybe pathology, then sometimes yes. But you can get out of optometry school without a residency right to practice. Yes?
So, how long did it take you overall to finish school?
8 years. 8 years, 4 years undergraduate and 4 years optometry school. 8 years. So if you want a residency, add an extra year on top of that, so 9 years. But for most people, most 50 and up, it's 8 years. Yes.
Why did you
I was living in Tallahassee. My parents were living there. I actually, if you're a dual enrollment, right? Everyone's got dual enrollment. I was doing that back in the 70s. My parents put me at the Florida High. Y'all play Florida High? Florida High, which is Tallahassee, which is part of FSU. FSU has a Department of Education where they train teachers. Many teachers from here come from Florida State University. So they needed in Tallahassee, some place for these teachers to practice, hence they developed a university school. University School of Florida High was also called the Developmental Research Center. It was a school that ran from kindergarten through 12th grade. My parents put me in there in 7th grade. So I was actually at Florida State from 7th grade on. 11th and 12th grade, I was literally walking across the street and taking classes on campus. They moved, they can't leave the school now, Florida High is now on the other end of town, so kids can't do what I got to do. But I was dual enrolled back in the 70s. Florida State had everything I wanted. I knew I was moving out after 4 years when I went to optometry school. I knew I was probably not coming back to Tallahassee. I wanted to be more coastal. And I knew if I stayed home for 4 more years, I had a good laundry plan and a good meal plan. So I did. It's not something everyone wants to do, stay for 4 more years to college, but it worked out good for us. My parents had a big house and we just kind of left each other alone. Yes, ma'am?
How about grades, GPA,
What they need now, about a 3.5, I believe. I got in with a 3. I got in with a 3 back then. Optometry, yes. There is an entrance test to take. It's called the OAT, Optometry Assessment Test, something like that. Just like there's a MedCat test to get into medical school, a law school test. There's an optometry test also to take beforehand. And people considering optometry, we had, again, I was a psychology major, but as long as you get your prerequisites out of the way, then you're cool. He's following the campus, let me keep moving around. With any medical field, you're going to need the sciences. You're going to need biology, chemistry, physics. You're going to need the math, probably through calculus. You're going to need other things that are more medically related. It's all pretty much a pre-dental program at a 4-year college. It's pretty much the same as a pre-med program. It's pretty much the same as a pre-nursing. It's pretty much the same as a pre-vet program. Pretty much the same, but they want you in the sciences and math. Yes?
What does your typical day in in your workplace look like? Do you see patients all day, or do you, what do you do?
I see patients all day. That's what makes the money for me. We sell glasses also, so that makes good money also. But I start about 9 o'clock in the morning. I see usually one full exam every half an hour. I will do checkups, follow-ups, office visits between those, take a good lunch time, and in the afternoon again until 6 o'clock at night. And I do that 4.5 days a week. My office is open 5 days a week. Used to be open on Saturdays. After 20 years of working Saturdays, I said enough of that. Nice. Yes?
What's the weirdest or coolest case you've ever had?
Weirdest or coolest case? Weirdest or coolest case? I've seen some pretty weird things. I treated somebody in the Army, so we're going back to the mid-80s, a grunt who picked up a frog and the frog urinated on him and got in his eye. So I was cleaning that out one day. That was kind of interesting. Not so much weird or cool since I've been in my current location. When I was at Eye Masters, that was kind of fun because Eye Masters would do a lot of advertising. They were promoting 1-hour care. So if you happen to lose your glasses when on vacation, you go to Lens Crafters, you go to Eye Masters because you know you can get it in an hour. And when I was there, I was almost guaranteed between Memorial Day and Labor Day, one patient a day losing glasses or contacts in the water here. They come, they see the beach, they run, they forget about their glasses, off they go. So there's got to be a reef out there somewhere with some glasses. I can imagine a fish swing by one door, it's going, wow. But, so yes, I've had, I don't know how many people dripping wet in bathing suits in my examining chair because they came right from the beach, lost their glasses, and they couldn't see where else they were going. So that was kind of fun. Interesting case. I've seen a lot of different pathology. I've seen tumors. And I've had a couple kids younger than you die from tumors I found in the back of their eye. So that's kind of interesting. It's fun, though. And some adults also. In fact, there was a lady in the paper about 2 years ago talking about the tumor she had in her eye. That's when I found it. So seeing that's kind of interesting to me because I know I can really help them right there, get them off right away so they get that tumor taken care of. Otherwise, I'm doing glasses, doing contacts. I've done some funky contacts before. People want to change their eyeballs to funky colors. We've done that. But if we get to my age where it's like don't rock the boat, make it nice and smooth. So all the fun stuff, I still do it, but just like to keep it quiet, keep it smooth. Yes? What? Oh yeah, for sure. In fact, I've got a husband and wife patients that are heterochromia. Yeah, they both are, and their kids are normal. What heterochromia is, then one eye is blue, one eye is brown. And I've got some patients where half the eye is brown, half the eye is blue. So there's some strange things out there also. I've got quite a few patients that have a glass eye. Pretty much anything you can think of eyes, I've pretty much seen it in my time that I do it. I enjoy the profession. There's nothing finer than sitting down with a patient, talking about the health care and seeing what I can do to help them out better. I really enjoy the profession. People ask me, when am I going to retire? I'm having too much fun. I really am. It's nothing fun than to go to work, close the door, sit down with somebody, let's talk about your eyes, things going on, what can we do to make it better? These glasses aren't working, why aren't these glasses working? What if we did this over here? Okay, why aren't these contact lenses working? What if we did this instead? Let's try this. I quite enjoy that quite a bit. Long day for me, yes?
How has your field changed since you first started in optometry?
It's gotten more medical. Back when I was going to school, we couldn't prescribe drops, eye drops. We could not prescribe pills. So it's gone more medical related. And to touch on that, why the problem then, and we still have issues today, is ophthalmology is an MD and we're an OD. Ophthalmology wants the big bucks. They get the big bucks, but they want as much as they can. So there's a continual fight between optometry and ophthalmology, that they think that we're quacks. They think that we shouldn't be doing what we're doing. They don't call us doctors, many of us. Now there's some in town that are very good, but others are very much anti-optometry. So that's been a big stumbling block for quite a bit. And there's still, I think, 2 states that cannot prescribe pills because ophthalmology is holding them back. There's a couple of states that can treat a laser, can fire a laser. Oklahoma and Kentucky can fire a laser. A few states can give injections into the eyelid where necessary, and a few states can prescribe more pills than I can. I'm restricted to 13 specific pills that I can prescribe specifically for the eye. Yes?
What are your top 5 favorite facts about the eye?
Top 5 favorite facts about the eye. Okay. Everything that we see is processed upside down and backwards. Everything that we see is processed upside down and backwards. The brain flips it up, right down. How about that? Okay. What else about the eye? Gee, I'm with it so much, it's just all routine to me, gee. Hi there, how are you?
Good.
You're late.
Yeah.
Did you bring cookies?
What?
If you're late, you're supposed to bring cookies.
I'm sorry, I didn't know.
Okay, well next time.
Next
Okay,
time.
next time. How are you? I'm Michael Fregger, optometrist. Y'all can come in too,
They're
no
not
charge.
in this club, they're just being loud.
Okay.
Sit on the bench.
Y'all can watch, I don't care, no charge. Might learn something, maybe not. What else can I tell you? Yes, go ahead, please.
How would you know someone has sugar in
Well, it could be above. First of all, talking to them. What's the problem? With optometry, as with medicine, simply sitting down and talking to the patient, getting the case history, talking about why are you here today? What kind of issues are you having? What's going on with your eyes? Talking to them many, many, many times, I know what the answer is before I even start examining them. So hearing the patient talking about what's happening, they've lost vision, they're having some issues, headaches maybe, and then go ahead and do an examination, dilate the eye, and look and see what's in the back of the eye. That's every time I find a tumor, I find it in the back of the eye. But there can be tumors on the front, on the lids, tumors can pop up anywhere. What's
So when you dilate eyes, how can you see in the back? What do you have to use?
I've got equipment that does that. Called an ophthalmoscope. I've got a few different ophthalmoscopes that can be used to look in the back of the eye.
And it provides a clear image.
Like you wouldn't believe a clear image. And I've got cameras also that can take pictures of the back of the eye also. We talk about dilation. What dilation means is to open up the pupil. Interesting fact. Back in the medieval days, women felt that they were more attractive to men, maybe men felt they were more attractive to women too, when women had big pupils. Okay? So they found back in medieval times that if they chewed on a certain root, it would make their eyes dilate. Okay? So that's where all these dilating drops come from. They're derived from this type of a root. So the family of drugs are called the belladonna alkaloids. Belladonna, pretty lady. Interesting fact also. And the same type of family that you would dilate the eyes when you're going in like the anaphylactic shock and you want to give yourself an injection to the leg, same type of medication, usually atropine in the leg. Atropine in the eye will keep the eye dilated about 30 days. So I use drops that keep it about 4 to 6 to 8 hours before I dilate the eye. Day to day, okay, well, first of all, which is better, 1 or 2? Have you ever had long time before? Of course, the next you have, you just got glasses on. Okay, so we put a big thing in front of your eyes. It's got lenses in it, and we start spinning lenses left and right, which is better, 1 or 2. First, before we even do that, I've done an automated instrument that you look in. It shows a picture of a house on the hill or a barn on the hill. And this has got what we call variable focus lenses in it. So lenses shining light to these lenses, looking at your eye, inside your eye, and seeing how the reflection comes back from the eye. And that can tell roughly what your prescription is. We like to check the pressure in the eye when we test for glaucoma. So I have what's called an air puff. And the air actually blows. People know the air puff. You know the air puff, right? You hate it, okay? You hate it. What, does it hurt? No. You hate it because you know it's going to blow something in your eye. It doesn't hurt. It just scares you, okay? That's what everyone hates the air puff. I like the air puff because my staff, my techs can do it. I have other ways of checking the pressure in the eye, but that requires me to put an eye drop in the eye, numb the eye, and actually pull the probe on the eye itself. Piece of you won't even know it's coming at you. You won't even know it's coming at you. So we check people with air puff and everybody. We have this automated refractor, gives me an idea what's going on there. Then which is better, 1 or 2. If we can't get that kind of response, and I pick up, like I said, with the auto refractors, the variable focus lenses, I would pick up what's called a retinoscope, and then start shining light with the scope through different lenses, and I can figure out what the prescription is also. I mentioned before we have a camera. Hi there.
Oh,
I'm still talking about it. Go ahead, interrupt.
I just wanted to ask, like, when you say that you numb the eye, would that not cause like a lazy eye or anything?
No, not at all. Use a short-acting anesthetic, it's an eye drop, it lasts maybe 20, 30 minutes. Yeah. A lazy eye can be a number of different things. What a lazy eye generally means is one eye is just not as developed as the other, or one might be not as clear as the other. You're wearing glasses, so both are about the same. But we've got some patients that may be a low prescription in one eye, but a very high prescription in the other eye, okay? So they're seeing halfway clear out of here with no glasses on, and over here it's totally blurry, okay? So the brain is saying to the eyes, wait a minute, we're seeing clear over here, we can process this way. This is blurry, giving us conflicting information. Don't accept what we're getting over here, treat over here, use over here. So the brain is saying, okay, turn this eye off a little bit. So that's a lazy eye. And if you don't catch it early enough, then the eye doesn't develop as it should. And by early, I'm saying about 8 to 10 years old. If you haven't been aggressive with it by about 8 to 10, that eye's going to be kind of lazy. And lazy might be blurred, or maybe it turns out, or turns in. Probably some people were looking at you with one eye when I was over here. That's a type of laziness also. A number of different things that be a lazy eye. Do you have a lazy eye? Okay. Yes?
I know one of my friends, she had, I think one of her pupils was bigger than the other one.
Okay.
Is that also lazy?
That's generally a lazy eye. There's some pupil issues. Could be a muscle issue. There's a couple different, when we dilate the eyes, there's 2 different muscles in the eye. There's a sphincter muscle which closes it down. There's also a dilator muscle. So the drops I use will do 2 things. Number one, they will stimulate the dilator muscle while at the same time inhibiting the sphincter muscle. Close it wide open. Oh, a number of different ways. First of all, I've got, like I said, the stuff with my techs are doing with the automated equipment that I've got. If you're coming in with glasses, I have that prescription also. So that many times gives me what things to start. If not, I pick up my retinoscope and I can, like I said, scope into the eye and get a rough idea what's going on and go from there.
So when you find like tumor per se, like how do you see kind of tumors like closely with a certain hospital?
I usually refer to an ophthalmologist for confirmation of that, and they've got the connection with the facility. Depending what kind of tumor it is, we need to take care of it. In surgery? Tumor, no, I have not. I've walked in, I've been on many cataract surgeries, I've seen some eyelid surgeries. I have not seen retinal tumor, that's all I've seen. I'd say that I'm kind of taking time off to do it. Go ahead.
What would cause somebody to have like an eyelid surgery?
A number of different things. She's asking what would cause somebody to need eyelid surgery. One thing that happens as we get older is that we get some excess skin. First, gravity pulls everything down. Okay, right? Okay, gravity pulls it. So as we get older, we tend to get excess skin elsewhere here. And we can get it on the eyelids, where the eyelids can start coming down a little bit. There's too much excess skin over time. So it's acting almost like a hood. I've got some patients who have to really pull their eyes up to see or have to do one of these numbers to see. So if we can prove to their major medical health insurance that this excess skin is a hindrance to their vision, then the insurance pays for an eyelid lift, plastic surgery. That's what would be for that.
And also, so since you have your own practice, do you find that doing the administrative work ever like keeps you from doing medical work?
Not really. First of all, I enjoy it, administrative work. And number one. Number two, my staff does a lot of it for me. The stuff I do, I just so I can keep my finger on the pulse of the administration of it. If I didn't like it, I'd get somebody else to do it for me, but I enjoy doing that. That's something I might do during my lunch hour or between patients or sometime on the weekend. Because that's part of me. Yes, hi.
What sort of administrative work would you do?
Insurance work for sure, running a business. Whatever you can think about running a business, paying bills, ordering supplies as necessary, whatever is necessary for the day-to-day operation of the business. Or a piece of equipment breaks down, get it fixed, or looking for new equipment. I was looking for new toys. Optometrists have got great toys. We do have fun toys. Whereas in family practice, they've got a couple things, but we have some fun toys. But whatever running a business, just like any other business, doesn't have to be medical, but any other business running a business from day to day. What turns the lights on? Yes.
You had said that your other career choice that you would look at was pathology.
If I wasn't optometry, if I wanted to be MD, probably pathology, probably.
What interested you about pathology?
Working with dead people. Figuring, because they can't talk to you. Okay, so why did they die? Figuring out why did they die? Dealing with that kind of stuff. Yeah, medical pathologist maybe. But luckily I didn't. With the eyes. What else can I tell you? Yes, sir.
If you were to do it over again, would you get your MD over your OD?
No, never. I like my OD.
Why is that?
It's a fun profession. I'm not working weekends. I'm not on call on the weekend. I am on call, but I rarely get a call. Whereas MDs are pulling hospital privileges, they're doing surgery. I'm not interested in surgery at all. And some of the things I'm just not interested in. I'm happy doing what I'm doing. I really am. It's fun. I really do enjoy it. Yes, ma'am.
How about macular degeneration?
What about it?
I don't know if there's a brand about it, is anything new?
Just what? She's asking about macular degeneration. What the macula? Does anyone know what the macula is? Okay. Central vision. I want you to have a picture of the eye here also. Central vision. When you're looking at someone, she's going for an eye picture. All right. Her central vision is going or gone. Correct? She can still see, she's using her peripheral vision, but when she looks at you, that's blurry or it's distorted. There we go.
It's got a whole bunch of notes on it.
No problem.
But
Take the corrected one.
it's on there.
All right. All right. Have you all seen this before? Okay. The macula is whenever you're looking, I'm staring at you right now with one eye. My macula, this part right here, is right on. Okay? So with her vision, that central vision is starting to go. Why is it going? Sometimes it's an age-related process. It could be something, body chemistry. It could be a nutrition thing. There's a number of different reasons why the macula could be going.
No, it's genetic. Mama had it.
Okay? So next, thank you, Mom.
Something finished with the body or something related to genetics instead of
Okay. So her central vision is going or gone. She can still see because she's using her peripheral vision. And if she looks around more, she could probably see more also, correct? Are you wet or dry? You're dry, okay. There's two forms of macular degeneration. The dry form is kind of that's what I would like to have, but there's not much they can do about it but watch. As opposed to the wet form. By wet, what that means is there's some leakage back there. Either some blood vessels are leaking or some other kind of fluid is leaking back there, causing issues back there. And for the wet form, they can treat that, usually by putting an injection into the eye. Taking a needle, say, look over here, and the needle goes straight in the eye, injecting some newer medications. And you think it's gross. Well, it is. But when I was going to school, they didn't have these drugs. If someone had wet macular degeneration, They would take your hand and say, we're going to get through this together, but you're going to lose your vision. And they could not treat you.
First sign of like tunnel vision, how long does it take to where you can't see anymore? Like,
What's causing the tunnel vision? Tunnel vision could be from a number of different things, including migraine headaches.
Yeah.
Migraines are notorious for tunnel vision or for different kind of visual auras or different kind of presentations. True tunnel vision, what's causing is it a occlusion of a blood vessel in the back of the eye? If that is, you've got to do it pretty quick because the blood stops getting flowing to the eye. It starts killing off the tissue really quick. So usually within a couple hours, if it's going on. If you wait a couple of days, it's gone.
Okay.
So, yes, ma'am.
What's astigmatism?
Big long word. What it means is your eyeball's not perfectly round shaped. The front of your eye that you can touch, your cornea, where the contact lens would fit, is more football shaped versus basketball shaped. That's all it means. So how do we correctly put an irregular shape in the glasses or the contact lens? Correct. What's nearsighted mean? Correct. Nearsighted means just that. You have near sight. You can't see out the distance. Just the opposite from far sight. From the far sight, you can see okay out the distance and having problems with close at near. Presbyopia. Presbyopia means you've hit 40 thereabouts and you've got bifocals. We're there, aren't we? We're there. Presbyopia. It's Latin or Greek for old age vision. That means basically between about 35 and 45. Nice picture again. We've got a lens inside the eye right here. There are some muscles right here that attach to that lens. It's that lens flexing with the muscles that allow us to see up close at near. It's called accommodation. When we look out the distance, that lens should be relaxed. And when I look up close and near, that lens does some flexing and focusing for me. At around age 35 to 45, it gets where it just cannot be as efficient as it used to be. It cannot flex and focus as much as it used to be. It's about a 10, 15-year process where it just progressively gets a little bit where it can't do as much, can't do as much. You get about 55, 60, and it's not doing anything at all. And that's why we wear bifocals. And I'm wearing the no line, or you put a line or no line. And what we call progressive lenses, so that we can see up close at near. You're shaking your head. It's going to happen to everybody in this room. Don't worry about it. Keep me in business.
Can't read like that.
Exactly. Your arms get long enough. You can do one of these numbers here. You put it down here, right over here. You squint at it. My wife will not put her glasses on. She's got crows. She can squint. Put your glasses on. What else? Yes, ma'am.
So, like when you rub your eyes,
Many times by rubbing the eyes, on the top of the eye, the front is a tear film, the tears. Blinking puts a nice, smooth film on it. You start rubbing that, and that's not a tear film. Number two, you can start pushing on the back neck, causing sensations. That's what I can do also. People. Hi there.
How do color contacts change your vision?
How do they do it? They are tinted or they are opaque for even for a dark person. It's like a paint on the lens. So that you put the contact on, the paint is over your iris so that you see the different color. Usually with a clear center. And there haven't been that many colored contacts. Last summer, about a year ago, they came out with a whole new series of them. So back in the Anybody wear contacts here? All right, cool. More so, someone's leaving over here. Did y'all say she could leave?
Yeah, I got a friend texted that I have to.
Thank you. Thanks for coming in. Before you two leave, if anybody ever has any questions, please call me. If anybody wants to come down and hang out at my office for an hour or two or half a day or a day, please call me and do so. Okay? Not all groups, but if one at a time, please. I want to come in seriously. Two, because you start talking to each other, having a good time in the corner. That's why. So if y'all would like to come to my office and spend a day or half a day or afternoon or a couple hours, please do. Please do. Give me a call. Let me know you're coming in. Let me look at my schedule. Make sure I'm going to be there, first of all. And make sure we have a good schedule that you can see what's going on in my office. And we'd love to have you there at any time. Yes? No. Unless they want some on this end. Unless the school wants some paperwork. I wouldn't need any paperwork off the shelf. Y'all have a good weekend now.
You
Take
too.
care.
Thank you.
No, not at all. Not in my office. And I'm almost right across you from Choctaw. I've had kids from Choctaw. I've had kids from football. also, so please do. If you have any, if it's not even optometry, it's the whole medical career, just want to see what happens in the office. Come on, we'll do that. As far as how am I different from the MDs, well, I sell glasses often, so I've got a retail aspect of my practice, okay? So we're selling glasses, we're selling contact lenses, whereas most MDs aren't retailing anything. They might retail a shot, they might retail a bottle of pills, but otherwise they're not retailing anything to you. So in addition to being medical, I've also got a retail aspect, so I'm a little bit different. If there are days when I'm not busy in the back doing eye exams, but my optical up front is slammed, and vice versa. There'll be days where I'm busy in the back and no one buying glasses up front. So it kind of balances itself out as far as how the business runs. You taking notes of your big. Yes, ma'am.
I'm trying to get into it.
So negative vision is a thing, right?
Negative vision is what?
A thing. It's like
Negative vision.
Yeah.
What do you mean by negative vision?
like yeah.
Negative, the minus in something, that's nearsighted.
It's inside.
Nearsighted. If you're like a -2, you're nearsighted at 2 diopters, as opposed to a +2, which would be farsighted. In the front part. Then you put on the end of that, put another plus, that's the plus for the prescription for the bifocal. If I can say, please tell me, please, I'm here. Yes, ma'am.
Okay, so I already asked you what like the weirdest and coolest cases are that you really have.
Okay.
But would you be able to name like favorite case?
In a way, one of my favorite cases was one of those kids, he's dead now, who had a tube in the back of the eye, because I found it, I sent him to the ophthalmologist, said this kid's got it, something's wrong with this kid. There was no bump to see, but something was wrong with this kid's eyes. And I had known the kid, and I had known the family for years. So I knew this kid. And I sent him to the ophthalmologist, and the ophthalmologist sent him back saying he's pulling my leg, he's joking, but his eyes are fine. And I said, no, something is wrong here. Take a look at this kid again. And he looked at it again closer, and the next day he sent him Shands and Gainesville because he saw there was something going on. So was it a good cool? No, but it was a bad cool. We found the tumor, we treated it aggressively. He passed away about 2 or 3 years after that. So that was kind of interesting. Other cool cases? Geez, I can't think of anything. I mean, it's all kind of fun, it really is. Yeah. Yes, ma'am.
Have you had any gross cases?
What do you mean by gross?
Like yeah.
Oh, for sure. I had one kid, the mother came in with the kid. We're adults here, yeah. Mother came in with the kid, this is about 10 years ago. The kid was about 16 years old, and the mother smiling in the ear, I think my kid's got gonorrhea. And there was just this pus coming out of the eye. Okay, I said, at which point I said, out of here, ophthalmology. But that was kind of a gross school case. But I've seen all kind of pus in the eye. I pulled foreign bodies out of the eye. And then I pull metal out of the eye once or twice a month. One of the muffler shops in town don't use the safety eyewear as they should. And when they're grinding metal, sometimes metal was flying, and we want to get it out of the eye real quick. Metal on the front surface of the eye will start to rust almost immediately. And it'll be rusting unless you get it out real quick. So that's something on the weekends when they're working weekends, I'm coming and taking rust out of their eyes. So that's pretty cool also. I've taken tree branches out of eyes before. And I've seen pictures of other things that are in eyes, which should be like a wild imagination would be in an eye. Cool. What else?
What is the reason you picked that up?
Weirdest thing I picked out of an eye. A bug. A bug out of the eye. Under the upper lid, they couldn't get it out. I had one patient call me. I had a patient who wore a contact lens on one eye only. She always just, it was fit, one eye good, one eye bad. She always wore contact on one eye only. Gave me a call about 10:30 night, can't get this contact off the eye. Really? Yeah, it's paining me, I get kind of aggravated, I can't get it off the eye. All right, come to the office. We get to the office at 11 o'clock at night, her and her husband. And I'm looking, there's no contact lens on that eye. Bless you. There's no contact lens on the eye at all. Well, how come I can see so clear? Guess what's going in the other eye? Somehow she put the contact in the eye. Never wore contact before in the other eye. Somehow she put the contact in the eye and was in front that day. Put the contact up, here you go. And I have to watch charge. It happens. You name it. You can think of, yeah, whatever you can think of probably will happen in my office, somebody else's office for sure. Whatever you can. I read blogs all the time. Guess what happened in my office here? So there are some strange things out there.
What's monovision?
Monovision, okay, with contact lenses.
My mom.
Your mom has contact lenses. Your mom is like me and this nice little lady over here who's lost up close that near. She can't see, okay? So when you can't see up close that near and you want to wear contacts, you've got three options for contacts. Option number one is to get the clearest and crispest vision. If you still correct both eyes for distance vision only, and then put reading glasses on over it. Okay? That gives you the clearest, the crispest vision. But ladies don't want to wear reading glasses, do they? No, so they want to get away from glasses completely. So if we want to get away from glasses completely, we have one or two options. We go a bifocal contact. This sometimes doesn't work. Or we can do what you just said, monovision. Monovision means correcting one eye for distance vision, correcting the other eye for near. So in one eye contact lens, dial in the distance driving, seeing the board contact lens power. On the other eye, nice teeth too, you're doing over here. Got you good. The other eye, cranking the up close near power. So one eye sees for distance, one eye sees for near. That's monovision. You'd be surprised. The vast majority of patients have no problems at all. The vast majority. The brain figures it out and gets used to it. It takes about a week or two, ask her. But after a couple of weeks, that brain figures. I get about, I'd say about 85% success with the monovision contact versus one contact. Less expensive than bifocal if you do the work. But one eye is always blurry. Distance eye is always blurry. Near your eye is very good. That's why I tell the patients to start out with. Do expect some blur. If you're going monovision, you will not see as crystal clear as your glasses ever will be, because one eye is always blurry. With both eyes seeing clear, you get a summation effect. If you close one eye and close the other, it's clear. When you open both eyes, you see better for most people. So monovision breaks that down. Monovision also gives you extra glare or goes to your halos at night driving. So cars headlight lamps will glare at night. Not monovision. Unless it's anyone. Yes, ma'am.
Do you have any advice for us,
Yeah.
or any advice for us for when we get to college and studying and stuff? Just a general question.
Any advice when you get to college and you're studying? Yeah, don't study too hard, party some, seriously. Life is too short. Study for sure, but make the most of it. Have a good time in college, yeah. You've only been there for 4 years, have a good time, make some friends. Don't spend the whole time in the I had many friends who, that's all they did was study. I was having a good time. In optometry school also, I studied. I wasn't the top of my class, I wasn't the bottom of my class. I was about the third of it. But we had a good time. I learned. We had a name in optometry school for the person in my graduating class with the lowest grade point average. Think about it. In the graduating class, the person in my graduating class, the lowest grade point average. We had a name for him. Doctor. He passed. Right? He graduated. Doctor. What I'm saying, yeah, enjoy school, for sure. But don't be such a bookworm that you can't go out and do the extracurricular activities also and have a good time. That's the best advice I can give you. Would you agree? Yes. My favorite one. I like the cataract case, believe me. You know what cataract is? Okay, who does not know what cataract is? Okay, where's our little picture again? Here we are. So many people starting around our age range usually will get some kind of a hazy vision. What causes a cataract? For most people, it's age. If the eye lives long enough, it's going to get a cataract for whatever reason. The sun's UV rays are very notorious for causing cataracts. We always recommend make sure the glasses you have UV protection. If you're getting sunglasses, make sure they have UV protection. But cataracts can be caused for a number of different, certain medications we take can cause cataract. Certain diseases can cause cataract. We can be born with a cataract, congenital. Trauma to the eyes can cause cataract. But for most people, it's an age-related process. Cataract surgery, and back when I was growing up in the 60s, before they had all the new techniques, cataract surgery, they would come in and they would make about halfway across the cornea, just tear it all open, just cut it all open, go in and yank out the old lens, and they didn't have new lenses to put in back then. So you go out, they would take out the old lens, And late after cataract surgery and it got stable, then you came out with nice, thick, what I would call Coke bottle glasses. We talked about the minus and the plus. Coke bottle glasses about a plus 14, plus 16, plus 18. But they've taken out the lens in the eye. So they put lenses in front of you to see. Well, geez, about the 1990, around 1990, that give or take a few years, they came out with a new technique called phacoemulsification, where they can make a very small cut in the eye, very small, about 2 to 3 millimeters. They could stick a probe in the eye. What this probe would do would be grinding up and sucking out the old lens in one quick motion. Okay? Then they also figured out they could put new lenses in the eye, put an implant in the eye, where before you had Coke bottle glasses, they figured out finally how to make a plastic or acrylic or a silicone implant lens. And they figured out how to fold it in half so it can go into this small 2 to 3 to 4 millimeter slit in the eye. Okay? So that is phenomenal. Okay? And then they also figured out that they got a certain kind of knife to make a certain kind of cut on the cornea, so that when you're done, you pull everything out and the cornea kind of heals itself without stitches. Well, that's pretty cool, I thought. And it is pretty cool. Cataract surgery these days takes less than 10 minutes. The time that the doctor walks in the operating room, picks up the scalpel, the time he's done is less than 10 minutes. I get the operative reports. If it's more than 10 minutes, I pick up the phone and say, what went wrong? If it's more than 10 minutes, it takes longer to prep you for the procedure than it does for the procedure itself. So that's kind of cool. They can take an old lens out, put a new lens in less than 10 minutes, and you're seeing clear again. So cataract surgery is one of the favorite one. LASIK surgery is a lot kind of fun also. LASIK surgery. Anyone know what LASIK surgery is? Hey.
Isn't it where they burn the back of your lens?
No. Okay, let's say you're go ahead.
Isn't it supposed to be any patients who have that burning contacts?
Correct. Laser surgery, LASIK is, I forget what it stands for, laser assisted, It's, they figured out the technique to remold or reshape the eye. Again, the cornea, the front of the eye, which you can touch where contact lens rests, that does most of your focusing, okay? And that's the curvature. So if you can change the curvature of the eye, or the cornea, then you can change the focusing. And that's what the laser does. It goes in and little by little shaves off just little micromillimeters of tissue. And you hear it go pop, 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 and you can smell it too. You get used to it. But that's what laser does. So you can, and what they need to do is they're lasering, there's 5 layers of cornea. What does the focusing, what they need to work is the middle layer. So you need to get to that middle layer. Okay? So there's a couple different ways to get to that middle layer. Prior to laser, they had something called PRK, where they would either put a little solution in the eye which would have to dissolve it, or they would just pick up a scalpel and just start scraping the cornea, getting down to the 3rd layer. Very painful about 3 to 5 days afterward. The cornea is very ingenious. It will heal itself usually within about a day or 2. People who are scratched, or have pretty deep scratches, abrasions, will heal usually in about a day or 2. So that is, losing track of it. So that is, it heals pretty quick. So anyway, they want to get to the middle layer of it. So they would scrape it off with PRK, then laser it, put a bandage contact lens on or a passing eye and say, come back in about 3 to 5 days. Here's some drugs, take the drugs, you're going to be kind of woozy, but you're going to come out of it.